Hi, I'm Olivia, a women's health exercise physiologist. This video is going to be focusing on scar tissue care post-surgery, focusing more on post-laparoscopy. So whether that was for endometriosis, other pelvic pain conditions, or maybe for fertility reasons as well. Typically without scar massage and desensitization, a safe bet would be from 6 weeks when we know that the scars are fully healed. Personally, I had clearance from my pelvic floor physio and from my surgeon to do this from 3 weeks. So it's very different person to person, and depending on initially post-op whether you've got like some bandages over your scars or whether they use a glue, and then often the glue you're able to start to peel off with warm soapy water from 1 week post-surgery. But obviously very different between all different surgeons, so double check with them. So we're going to focus more on the massage first. Using either like an oil or a cream. So the Bien Scar and Skin Oil is a really good one. Otherwise, some bio oil or some vitamin E cream. So obviously pulling down so that you can see your scars and just getting a little bit of the oil. Now, particularly if you're early on post-op, so when I started at 3 weeks post-op, you really don't need to be using much pressure at all. So I'm just using 2 fingers, and I like to just start with some circles. So getting all different directions of pulling around the scar, like super duper light pressure. Could do say 10 circles, 10 the other way. And then going into vertical, up and down. And again, say doing 10 of these. You don't want it to feel painful around your scar. You might feel some pulling, but it should still be comfortable to do. And then if we go across, like horizontal. So again, if you're just starting this and you're pretty early days post-op in that 3 to 6 weeks, just super light pressure. I'm just using 2 fingers. Then working on a diagonal, obviously grab more oil as you need as it rubs in. So we're just exposing the scar to all different directions. This will help with healing of the scar, inflammation, and helping to prevent any adhesions or scar tissue underneath. And then going the other way, diagonal. And you can do these exact same things. So I'm now 7 weeks post-op, so I'm starting to use more of my fingers and doing more pressure. So just as it feels comfortable, starting to use more pressure. And then you'd obviously work and do the same thing through all of your scars. The one in the belly button, I can't actually see mine, but obviously it's still there. So still important to do some massage around that area. So even though it's not directly on top of the scar in the incision, same general thing, all the different directions. Again, light pressure if you're first couple of weeks post-op, and building to more pressure as you feel comfortable. And then again, as you progress to your later weeks post-op, particularly important to not just focus directly over the scar, but a good chunk above and below the scar as well. Just rub a bit of oil in. So I start to make my circles bigger. And I'm really starting to use some pressure as well to get the tissue below the skin moving. So it's not just the scar tissue right under the scar that we're focusing on, but the whole area. Could even do both hands if you wanted. And then another focus of our scar massage is also to desensitize the scar. So that is meaning like exposing it to different fabrics and materials. So We have like the BN scar roller and massage tool, which obviously has more of this softer end and then more of this harder end. You could also do something like a tissue, just wearing different types of clothes as well, literally just to get the scars used to these different sensations. So at the start, more 3-4 weeks post-op, just lightly brushing a tissue over the scar, and not just directly on the scar, but above and below it as well. Don't forget belly button. So that it's not becoming sensitized and it doesn't have this protective response. And then if you've got these scar rollers, usually starting with the soft end, and again the different directions. Again, light pressure to start with. You can take it slow as well, particularly if it's the first time doing it. Just letting your body know that this is a safe thing to do. And then as you start to feel good, you can apply more pressure. And then again, those different directions. I'll come over to this one. So obviously using more pressure will challenge it more. And then once that feels good, you can use the spikier end as well. Again, you can take it slow and just do light pressure. And then as it feels good, bigger and more pressure. Obviously not poking it in your belly button, but you can do it on the tissues around belly button. So doing this daily, if you can. And then another great way to take care of your scars to help with the healing and the appearance of them, and so they're not as raised and bumpy, is using some silicone tape or some silicone strips. So just like this comes in a roll, and I'm just going to cut a little bit off the roll, like that much. So that's going to proper cover the scar. Obviously cutting 3, I'm not going to put it over my belly button because it's not actually going to be in contact with my belly button incision. Important to wash the oil off before you put the silicone on, otherwise the silicone won't stick. But just for this video, I'm just going to show you. So you just peel it off the back and then just place it directly over the scar. Give it a little rub, and then pull your pants back up and it will sit nicely under there. There's instructions on the box, but you can reuse the silicone. So you just wash it under warm soapy water. So I like to do my oil massage before the shower and then wash my silicone strips, let them dry whilst I'm in the shower, and then I put that back on. Obviously the oil is rubbed off from the shower, and then the silicone strips will be dry that I can pop back on. So I hope that helps with your scar care. If you have any questions, then let us know.